I want to welcome everybody to our April Zoom formation call. I am past director Stephanie Urchik, and I'm sitting in today for Director Peter Kyle and Director-elect Jeremy Hurst. Both gentlemen are in Evanston today because they're participating in the Rotary International Board meeting. So I know they would prefer to be with us, but they're taking care of special business. So thank you for joining us today. On the Rotary calendar, April is noted as the month we celebrate and recognize our focus on child and maternal health. And we have several experts today who are going to share some information with us and give us some updates. But I'm going to start the first part of our meeting today with a few general announcements and updates. The first one has to do with Peter asked me to speak about an update on Ukraine. I think by now most of your Rotary clubs in your districts have reached out because we are people of action, and you found some way to help the humanitarian crisis in Ukraine. You know, there are two ways that Ukraine needs our help as Rotarians. One is in immediate relief, and one is in long-term relief. Immediate relief, I know there are all kinds of opportunities out there. Some of you have reached out to districts in the Ukraine and other clubs in the Ukraine. Some of you have looked for Rotary endeavors like our disaster response fund. Some of you have looked for things like the World Central Kitchen and Brothers Foundation and all sorts of others. No matter what you've done, thank you. It's just important that we do something. In terms of immediate relief, I mentioned Rotary's disaster response fund. The Rotary Foundation created an avenue for Rotarians to be able to help this humanitarian crisis. And that fund does provide relief in two ways. Immediate relief is happening through countries that border Ukraine, Slovakia, Hungary, Romania, and Moldova. Districts in those countries are able to right now apply for an expedited response fund of up to $50,000. So I know many of you have reached out. If you want more information about that, if your club would like to jump in on any of those now, those grants are going to help with immediate needs. They're supplying food and medical equipment and medical supplies. But the disaster response fund is also going to be there for when we need to help rebuild. You may remember what happened after World War II. Rotary was there to help rebuild. We may not build the schools, but we're going to help put computers and textbooks there. We may not build the hospitals, but we're going to help put medical equipment and supplies there. So we really need to be at that forefront. Those of you with districts, you know that you can move some of your DDF to that fund if you do it prior to April 30th. Individual Rotarians can donate to that fund, and if you do it prior to April 30th, it all will be directed to the Ukrainian Relief Fund. So I applaud those of you who have taken action, and I urge those of you who are still looking, find something, do something, whether it's immediate or long-term. The second thing I'd like to update you on is the Houston Convention and our Southland reception. You know, we have a little over 11,000 people registered for Houston, but the good news is more than 4% of that comes from our two zones. I am so pleased that there are so many of us who are going to be together in Houston. We heard from our general chair of our Southland reception this morning. We have over 450 people registered for that event, and there's still room for about 100 more. So if you have not yet registered for the Southland reception, what a bargain. It's only $35, and it includes beverages and food and an opportunity to hug and shake hands with all of the Rotarians that you have missed. So I hope you'll take advantage of that. All right, we have two more updates. I'm going to call on past District Governor Dawn Rochelle, who is going to give us an update on the Empowering Girls Seminar. One was just recently happened and the one that's coming up. Dawn, over to you.
Absolutely. Thank you so much, Director Stephanie. And yes, thank you so much for everyone who has been a part of the Empowering Girls Now series that Zone 33 and 34 Empowering Girl Task Force has been so honored to partner with so many around the world to bring you the best and the brightest speakers to help engage us in thinking through what more can we do to help equality of our girls around the world. Our next webinar, which will be our third, will be held on May 5th. That's an easy date to remember. It will be at 11 a.m. Eastern. And if you're wondering how to register, I'm glad you asked. I'll be putting that link in the chat so you can go ahead and register from this call today. If you're interested in listening back in to the webinar that we just held, we cannot be more thankful for the Zone 34 public image team who continues to support us in all of our media and our marketing and curating these videos. And so I'll also be dropping a link to that as well in the chat. We cannot be more aware of the needs of our girls in our world today, especially as we continue to watch the unfolding crisis in the Ukraine. We are concerned about women around the world and the lasting impact. We also know in our own backyards that we have much, much more that we can do. And we thank you for all that you continue to do as Rotarians across this world. Thank you so much, Director Stephanie.
Thank you, Dawn. Now I'm pleased to call on past District Governor Clinice Platt. Clinice had this fabulous idea about a project that she brought forward to Director Peter, and we're so happy that he said, this is great, let's do it. So I'm going to call on Clinice to tell us a little bit more about Are You Being Served? Clinice?
Thank you so much, Director Stephanie. It's a pleasure to be with everyone today. We are so excited about the You've Been Served initiative. I know that many of you all on this call have heard about it. Many of you all, I believe, have even participated or are planning to participate in this project. But just a quick recap, this is a 60 days of service, acts of kindness and fun initiative that is for all of us, all Rotarians, all Rotaractors. Even we want you to even think about including your interactors in this, but a great way for Rotary to make a difference in our communities right now, just by doing acts of service, acts of kindness. And we have a rotaryserves.com website, and I'll make sure that gets put in the chat box, but you can go on and find out additional information. You can on that site, you can go in and put in your scheduled activities. It has been phenomenal to see what you all have been doing. People have been providing food and hygiene, collection opportunities, road and neighborhood cleanups, heroes banquets, a day of service from 8 a.m. to 8 p.m. Love that idea. Backpack motivational notes, pizza parties for college students, as well as college food pantry donations, preschool book donations, all types of amazing projects. There is a project that is available on the Zones Facebook page. One of the clubs created a video and wanted to share with the Zones and others in the district. This club happens to be in District 7600, Powhatan. They took $2,000 and then made the You've Been Served initiative just kind of plastered around their community. And I know another club has done a great job. They put on their Facebook page, letting an announcement to their community, letting them know during this month of April, look for opportunities because they are going to be all up in their community doing the You've Been Served project. So that is just so exciting. We want you all to continue to do that. You can use your Empowering Girls initiatives if you're going to do something fun, or even if you've already done something during the month, because remember, this was from February 23rd, which is Rotary's anniversary, and it will conclude on April 23rd, the week of Paul Harris's birthday. So if you've done a project, please go back in, and if you haven't put it in the schedule or submitted a project, go back into our rotaryserves.com and put that in. We're loving the pictures. Oh my goodness. One club paid for uniforms for an entire, I think it was a youth I'm sure it was a youth baseball team. I mean, just amazing. I love what you all are doing. We want to make sure that people continue that momentum. And as I close today, I want to make sure that on the rotaryserves.com website, there are the You've Been Served logo is available. There are You've Been Served cards if you want to use them. We want clubs to do what you feel comfortable. Sub clubs have actually given out the cards and given their members actually 60 days to complete the project any way that they want to. Whatever works for you is what we want you to do. But one of the things that I really want to end with, and I want, as we look at what's happening in our world, we see it in Ukraine, we see it in our communities. One of the things that's so important, this project is really based on Rotary's motto of service above self. And one of the things I just want to reemphasize is that kindness and service are understood in any language, in every community, and we have an awesome opportunity to spread the word. So thank you so much, and I'll put the information about the website in the chat box. And if you want to share your project on our Facebook page, please do so. We'd love to see more. Thank you so much.
Thank you, Clinice. You know, one of the most exciting things about that whole project, Are You Being Served, is the fact that we get to share ideas with each other. There's nothing like sharing to just remind you that you don't sometimes have to recreate the wheel. It's already out there. You know, lots of good ideas there. I'm always fond of also saying that active clubs are attractive clubs. So if you want people in your communities to see what Rotary does, pick up on this idea, Are You Being Served, and share what you are doing in your local community to make it a better place. So thank you all for all the updates. We appreciate it. Now I'm going to call on our first speaker for this afternoon. It's my pleasure to introduce past District Governor Cindy Dora. Cindy is a member of our Rotary Works team. You may remember that over a year ago, we launched in zones 33 and 34 a special initiative called Rotary Works. It has many components, including seminars and a website with a job board and an impact fund, and lots of great ideas for people who are in career transition, looking for mentorship and coaching, or simply looking for professional development. Cindy is here today, I think, along with Rotarian Susan Quarter, sorry. I had a brain moment there. Quarter, who is going to share with us some exciting information about a Rotary Works event that is coming up. So Cindy, it's yours. Take it away.
Thank you so much. I appreciate the opportunity. This initiative has been a fabulous opportunity for Rotarians to serve Rotarians, and what really started as a brainstorm from Stephanie has exploded into fulfilling the needs of so many Rotarians throughout our zones. And of course, our Rotaractors, which we always want to provide them an opportunity to work hand in hand with us. We are extremely excited about the encore of Rotary Works, which is going to be a production wherein we have guest speakers from around the country, in fact, international speakers, that will be addressing topics that Rotary Works has been dealing with as it relates to Rotarians and Rotaractors experiencing some career transition. You know, the pandemic hit everybody really hard, and several of our family members in Rotary lost their jobs, or things changed in a way that wasn't necessarily to their best interest personally. So we've been able to fill a void that I feel has been extremely beneficial to so many. If you haven't already done it, I would like you to mark April the 22nd, which is a Friday, at 6 p.m. on your calendar, as well as Saturday the 23rd. And Clinice, thanks for bringing up that April 23rd date. It's an important date in Rotary. But on the 22nd, we're going to have an introductory event wherein we're extremely honored to not only have our directors involved in the evening's event, But past Rotary International President Barry Rassin will be our keynote speaker. And I believe Barry is on the call today. And Barry, I cannot thank you, and the team at Rotary Works Encore cannot thank you enough for your willingness to participate and continue inspiring and motivating so many of us throughout our zones. I will tell you that as we began working through this process, we really wanted to complement the programs that Rotary Works had put into place. And we wanted to bring speakers to the forefront that would really take advantage of providing the background, the information, and the support that we thought would prove beneficial to our members. So I'm going to kind of briefly go over our speakers for Saturday on the 23rd. We start at 9 a.m. And once Rotary International Director Peter Kyle starts the welcome and introduction, we are very excited to meet in person, direct from Scotland, our Rotary International President nominee, Gordon McAnally. He at first said, Florida, I want to come. And of course, we would have loved to have had him live, but we told him it was a Zoom webinar. But he's going to start our morning off at 9 a.m. on the 23rd and talk about how important that we stay focused on the cause of giving back to each other and serving those in need at the time. Rotary International Director Valerie Wafer, she's going to be stepping up at 9:30. We're going to have Mark Miller. Mark is the Vice President of Business Development for Chick-fil-A, and he's going to be joining us to talk about motivating our members and not losing sight of what's important professionally and avoiding the quicksand that's out there that can sometimes distract us or trip us up. We're going to have past District Governor Vanessa Irvin. Most of you on the call know Vanessa. She is not only an amazing woman, but a dynamic speaker. And she's going to be focusing on looking within ourselves and focusing on our talents so that we continue to have faith and confidence in ourselves. Jonathan Lucas, Jonathan is a writer and a professional speaker in his own right. And he's going to be speaking on topics that really speak on vocation and understanding the dynamics and the pitfalls that are out there in the world and tying it into the resources that Rotary Works has established and provides our members. Then we're going to jump onto a topic of how we want to invest in our futures. Our future is Rotary. And we've invited a young Rotaractor by the name of Emily Boxma. She goes by MJ. She's one of those great young leaders in our zone that started as an interactor in middle school and high school, went through RILA, was a youth exchange student. Now she's at university as a Rotaractor, and just how important the relationship and mentorship through Rotarians is and has helped her through her walk. And then, of course, in Zone 33 specifically, we're really excited to have past Rotary International Director John Smarge. John came to us and said, I'd really like to talk about a master's in life. And John is going to provide the value proposition of what we learn and accomplish and gain by our relationship as Rotarians and how that affects our lives professionally and how it can profoundly affect the lives of so many others. We're going to follow up with a Rotaractor who is now a Rotarian from the Caribbean. And she is Giselle Holder. She's a dynamic young up-and-comer, and she's going to round the whole focus on investing in youth service for the future of Rotary and those relationships and how significant they are to our future and how all Rotaractors should embrace the relationship with the local Rotary clubs that they affiliate with. George Lewis, for those of you who haven't heard George Lewis, he's the waterman in District 6960. He is passionate about clean water and sanitation. He's going to join us and talk about thinking, what are you passionate about and how do we bring that to the forefront? And how do we utilize that passion and that gift and enthusiasm and help to motivate others? And again, relating it to the programs that we've established through the Rotary Works initiative. And then last but never the least, Sylvia Whitlock has agreed to finish our day, and she's going to come before us and talk about never giving up. Because what we have found throughout our initiative in Rotary Works is there have been many Rotarians and Rotaractors that have started to give up in their walk, started to give up in believing in themselves, believing in their credentials, and believing that they can continue to make a significant impact in the professional world as well as their personal lives. So she is a dynamo, as all of you know, and we're really pleased to have her. And then of course, our own Stephanie will finish the day thanking everyone for participating. So I submit to you, please, if you have not registered, do so, because this is going to be a 25-minute increment. Each speaker has 25 minutes. They're in, they hit their topic, they're out. It's going to go all morning, and it is absolutely going to be an amazing opportunity to experience these dynamic speakers in one morning. Now, I've been looking as I've been talking, so forgive me if you've seen my eyes going back and forth. Doesn't look like Susan was able to make it this morning. So I'm going to just do a real quick overview of the marketing and promotional pieces that she has put together. We are extremely excited, not only by, you see my amazing backdrop here, but we have been working diligently on sharpening our image at Rotary Works, sharpening the message we've been trying to portray. And for this specific event, we put together an amazing marketing program that I know Susan is sharing throughout the zones, 33 and 34. Many of our international friends have reached out and asked for our information as well, and they're going to be joining us. And I will certainly put the registration link on the chat as well. But please know that all of your personal PR opportunities, Facebook, Twitter, things of that nature, we are trying to really make this a personal invitation to as many Rotarians and friends of Rotarians and Rotaractors as we can, because we recognize the value proposition of helping each other. And really, past Rotary Director Stephanie said it so well. Rotary Works represents a hand up, not a hand out. And it's our job to help the family of Rotary, those out that are in need, to give them a hand up while they might be looking for opportunities to either change their vocations or enhance where they're at today. So I know there are probably some questions. Certainly feel free to email me. Most of you know how to find me. But Stephanie, we appreciate your confidence in us. The team that we have put together is amazing, dynamic, professionals, motivated, excited. And the 22nd and the 23rd are going to be an amazing opportunity. So please plan on joining us and mark your calendars now. Stephanie?
Thank you so much, Cindy, for sharing information about that event. We all are very excited about it. You know, vocational service remains an important part of our areas of service as Rotarians, and Rotary Works is an opportunity for all Rotarians to either provide or engage in vocational service as an initiative. I also want to share that on the 23rd, we'll be making a special announcement about a new program that's coming to Rotary Works, as well as a change to one of our existing programs. So you may want to tune in and hear what's happening, what's coming up. Thanks again, Cindy. All right, we're going to move on to our program. We have two experts with us this afternoon, two Rotarians who are going to share information about child and maternal health. Our first speaker is Dr. Himanshu Basu. Dr. Himanshu Basu is a PDG. He is from District 1120 in Southeast England. He has an extensive background, both medically and in Rotary, but I'm not going to spend a lot of time on it because I want you to hear the amazing information from Dr. Basu. So Dr. Basu, please, welcome to our zone meeting, our Zoomformation call, and I'm going to turn it over to you.
Thank you very much. Can you hear me?
Yes.
Yes. Friends of Rotary, good morning and good evening. I thank you very much, RI Director Stephanie, for inviting me and for your introduction and the warmth of your welcome. It's wonderful to be here amongst friends, and really it's a great privilege. You have such a wonderful group of people and a meeting, and I am learning all the time. So I'm a student all my life. And as you have introduced, I have been an obstetrician gynecologist for about 40 years with all sorts of things I've done. And I've been a Rotarian for over 40 years as well. And I feel so much at home that you are discussing vocational service as a way of serving through Rotary. And I think this is very important. It's not just about money. And unlike money, vocational expertise which you transmit never runs out. It's there and it actually gets better. So what I'm going to do, I'm going to do three things. But before I do anything else, I just like to make clear that I'm speaking in front of you on behalf of a large number of people. Certainly our group of alumni, the Rotary Action Group, which I'm happy to share platform with John, Rotary Fellowships, and many others, who together put their expertise, their time, their energy to create a program, sorry, not a problem. And so that's our background. And I think the second thing I want to do is to ask you for help in removing the greatest social injustice of the 21st century, I call it, and that is avoidable maternal death. You see, mother is the most important person in our lives. She is our incubator, our life support machine for 9 months. And no matter where in the world you were born, your mother risked her own life in bringing you to this world. Nobody, absolutely nobody on earth risks their own life in giving another life. So I believe mother is the most important person. So as I said earlier on, I am here on a mission. I am seeking justice for our mothers who are still dying unnecessarily at childbirth. And I hope you will join us to save their lives. And I'll explain to you how that can be done. And you create opportunities to remove the greatest social injustice of the 21st century. I'm just going to share the screen now. So let's do that. Can you see the screen? Yes? Can you see the screen? Yes, you can.
Yes, we
Good.
can.
All right, many thanks. I think this is the problem that we face. This is a real story. It happened 2 years ago in Jharkhand in India. This woman was bleeding towards the end of her pregnancy, and she bled for about 2 days before anybody took action. Then there was no transport, and then they just carried 7 kilometers. Went to the hospital. The only doctor available was off duty, and she died, and the baby died too. So what can we do to stop these things happening again? And I like to put the thesis that the danger is the delay in giving treatment. We don't, in the West, we don't realize when something goes wrong, you go to the hospital and you get your treatment. So it needs, my fellow Rotarians, a mind change, a behavioral change, that when a woman at the end of pregnancy and the babies too have problems, they're like fire. You've got to douse the fire before you call the fire brigade. This is very important. So that's our thesis, the program. Now look at the the burden. 800 mothers are dying every day. 2 fully loaded jumbo jets are colliding. And this is linked, by the way, of disability of 6 times as many and child deaths of 8 times as many. And the sad thing is, most of these are preventable deaths. So that's why I said that this is the greatest social injustice of the 21st century. So let's look at what's happening worldwide. Now, the world's population, government, everybody else worked to reduce maternal mortality. This was known as the Millennium Development Goals. It started in here on the right-hand side, if I could direct you. From 1990 to 2015, these figures, by the way, 600 represents how many mothers die out of 100,000 live births. And it was about 600, and it should be, according to the Millennium Development Goal 3, a three-quarters reduction, so 1/5, 150. But it's actually somewhere in there. So that's bad enough. We now are in SDG, Sustainable Development Goal era, where things are going to move further towards 2030. But I like now you to concentrate on this. And this is the world divided. The northern parts have where they have reduced green areas, very good. But look at the sub-Saharan Africa and South Asia, and of course South America, parts of it, where they are suffering. And the suggestion that you and I will have as Rotarians, why can't the Rotarians and everybody else in the good parts, the green zones, join in solidarity with Rotarians in these other areas to save mothers and babies dying at childbirth? So our program CALM was born, and I'll just, you might ask, well, what is it? It stands for collaborative action in lowering of maternity encounter deaths, that's the mother dying and child dying. And as I have explained to you that there are 3 delays. And if you visit our website, you will get lots of details. So if I may, with your permission, I want to move on. So it is a project as well as a program. It's both. And so what is the program? And that is to upskill the health professionals and build capacity and bridge gaps in care through training. So imagine there are 10 doctors. You're building an outer layer of perhaps another 20, 30 doctors and nurses who are not doctors, but who can give you help in emergency. And secondly, you're empowering your communities because they need to more help, they need to identify gaps, and so you need to bring the healthcare to the communities. And this has to be tailor-made to their needs. So what is good for Uganda may not be right for Mali and so on. So we did this in 3 steps. And this is this complicated slide. I'll just try and explain a little bit slowly. So the first thing we did is upskilling and capacity building. This is the training the trainers, the top one. Remember, our first task is to reduce the 3rd delay, which is when in a hospital, in an institution, you expect expert care, but they may not be available. So we go and teach a group of senior people, 30-somethings, using simulators, using videos, films, so that they get practical training. They then train others, and this cascade goes on. The second thing is we go to the villages. This program was, by the way, in India, and I'll explain to you. But they improve here. The women's group are sitting around, and there is a lady called Asha. It stands for Accredited Social Health Activist. They talk about how to eat in pregnancy, why do you attend clinic. So it's a cultural behavioral change, improvement, so that it improves the health-seeking behavior. And of course, we measured this as well. And the third thing, we have not quite established this in many places. There are some difficulties. If there is time, I'll answer questions. But what is needed when there is a problem, you need resuscitation at the point. Remember, the woman or the child is in fire. So you need to don't transfer them for the next 2 hours in an ambulance. Most of them will die. So you've got to do, this is like the golden hour concept. So nothing fancy, use an anti-shock garment, give an injection, keep the baby warm, etc. How did we do this? And this is the training we used, World Health Organization approved, emergency skills, and the Global government they have their own program. But please don't forget, not only training, but we need to promote family planning and we need to promote respectful care. And once again, that's our website. So what is the next thing we did? Well, we have to do impact assessment clearly to see what is happening. And we did this. The MPDSR stands for Maternity and Perinatal Deaths Surveillance and Response. It's a WHO program of varying degree of complexity. A lot of governments are introducing this. But what it is, basically, we're doing the training, looking back to see how good, how bad it is, and adjust the program. Just to summarize our programs, we've done 2 completed global grants in Sikkim and Bhuj, that's in northern India. We have got 2 ongoing, one in Meghalaya in India, and the other one is in Uganda. And this is what we have got. So lots of data, not all of these are validated, so I'm slightly hesitant to say too much, but basically we have evidence that 402 lives were touched. These are people who have been given the extra training, skills, the vocational training, and their knowledge scores are improved. We saved 705 lives. This is called model estimate, sample registration survey. Not 100% accurate because the data collection is poor, but even if you can save one life, it's worth it. And of these 705, 123 were mothers and 800 communities did. What is matters is here. This is a village women's group. This woman here is teaching, training, and it's called the life-changing experience. So my friends, these are not just numbers, they're real people whose lives have been transformed. And I think we should continue to do and learn. So the program doesn't stop there. You might say, well, that's the end of the global grant, which is true. But we have created resources as legacies and assets, and this is helped. And I heard earlier on how we have been helped by COVID pandemic, paradoxically, because people are doing programs, we're collecting more data. So just to give you a flavor of this, the program assets and legacies are in two format. One is the manpower. These are not all master trainers, by the way, but they are our group, VTT, master trainers, and then basic trainees all together in Sikkim. We've done similar things in other places. We produced a toolkit. Some of these are obviously manuals, books, but many are digital. And we were trying to establish a communication network, mentoring network with telemedicine. Not quite successful, but uh, I would come back to you. But what is we have done is this. We've become a smart program because the impact is sustainable. The impact has been measured, at least as far as we can. The impact can be adaptable, and this is very important. I don't want you to think that one size fits all. The impact is resource. Look at all these manpower and other resources. Obviously, we need money, and it is targeted. It goes to the place where it's needed. So this is our summary that we have program assets and legacies. We can recycle, we can recreate a bespoke program based on the needs and priorities of these sub-Saharan Africa and South Asia. And that brings me nicely to introduce our technical expert networking group, TINA, because obviously I've ignored. Now we are not alone. We could not do all this alone, my friends. So we started in 2010, and we have produced a collaboration partnership model, not only within, but beyond Rotary. And that's at 3 levels. And the good news is we are growing. So what are these? Sorry, my apologies for this complicated slide, but please bear with me. Our partnership here, first of all. We have government, this is India. We have got our Rotary CALMED program, which is what, but we also have Rotary Action Group on reproductive maternal and child health. We also got Rotarian Doctors Fellowship here, and then other organizations. Please don't worry about that. FIGO is a world body of OBGYN, etc. And then this is the amazing thing. Rotarians across the continents united. For the time being, I can mention UK, India, Switzerland, Uganda, Nepal, and of course, Japan and US. So this is a good example of solidarity, a bit like polio eradication program. Now, you may be asking, who are all these people here? Well, the answer is they are our technical experts. They are our alumni, BTT group, our international uh, program supporters, and they are Rotary Maternal Child Health Action Group. They are the Doctors Fellowship, and of course, Cadre. And this is what is going to create TINA. And that's what I'm summarized. So this across the continents, we have joined together for 3 things. We joined together for a strategic partnership, for tactical partnership, and I'll explain that in a little bit, and the operational partnership. Now, what it means that we need, it's like a war, if you like. Now, war is not won on weapons, it's won on strategy. So what have we done to scaling up of this program? We need to rely on TINA, the experts. Now, in Rotary, we have got experts, of course, in RMCH Technical Advisory Group, which I'm proud to be director. John is our chairman. And we then have expertise in discs. And lastly, we have expertise in the cadre. So what we are asking people to do is this. We have a strategic alliance. This group decides where we're going to go, what are you going to do, and is it sub-Saharan Africa, which country, and of course, possibly get some help. So that's that one. Please don't worry about the details. I can discuss later. I just want to finish now, looking at the time. Tactical alliance is what thing we're going to use. So here we decide the technicians, the academics, the WHO, the FIGO, universities, experts, professionals tell us what to do. And thirdly, operational alliance. This happens at the country level where people join together. We have country champions and we join together with the country government, with the World Health Organization. These are called Quality of Care Network, by the way, if Rotary joins and others like UNICEF. So it's rather than working in silos, if we all join together, as our example shows, we get better results. So therefore, to finish, I'm asking you to consider joining a revolution to reduce and remove the greatest social injustice of the 21st century. Please join TINA, and these are our commercials. Wednesday, this 2 days time, we have a webinar. We have a keynote speaker of Dr. Anshu Banerjee. He is WHO director, and we'll have 3 other speakers. So that's the Zoom code. We have another on April 22. You mentioned Gordon McInally. He would have come, but unfortunately he cannot. We're trying to get a replacement. And finally, in Rotary International Convention in Houston, we have a booth. We have 2 booths for between the RMCH Action Group and the TINA. We have a breakout session. Please join us. This is a very large breakout session on Monday at room 320. And if you want to know more, please contact me. That's my email address, and of course, our website address. So I thank you again very much for listening to me and giving me the privilege of being here. If you want to be part of this action, please join, please support Tina. And I think that on behalf of all those women and children whose lives your action will save, may I thank you most sincerely. Thank you very much.
Himanshu, thank you so much for sharing this important information. You are so right that mothers are selfless in their mission to bring all of us into life, and the work you're doing is very important. Regrettably, we don't have time for questions because we're running behind. So I would ask you, Himanshu, if you would post your email again in the chat so that as people have questions, they can reach out to you directly. Thank you. Thank you so much. Our second speaker guest this afternoon is Dr. John Townsend. John is a member of the same club as our director, Peter Kyle. He's a member of the Rotary Club of Capitol Hill, which is in District 7620. And he happens to chair the Rotary Action Group for Reproductive, Maternal, and Child Health. Again, his background is extensive, just like Dr. Basu, so I'm not going to spend a lot of time sharing that with you. Rather, I'm going to turn it over to John so that he can share important information. John?
Thank you, Director Stephanie, and good afternoon to other directors and Rotary colleagues. Dr. Basu has given us some great data on the magnitude and distribution of preventable maternal deaths. And I'd like to share the screen for a moment to, let's see here. Yeah. Thank you. one of the reasons that their mothers are still dying, and this is a quote from Professor Mohammed Fatala in 2006, an Egyptian OBGYN. He said, mothers are still dying because societies have yet to make the decision that their lives are worth saving. And we know one of the key issues is that you can't separate mothers and children and infants. You need to think of them as a dyad and address the needs of both. People who are only working on infant mortality forget that there's a mother there, and she's a critical partner in survival of both. The second thing we need to do is kind of understand the costs of the failure to act. While we've seen the reduction globally, there are still countries in sub-Saharan Africa, South Asia, and including the United States, where maternal deaths remain unacceptably high. We know about the tragedy of preventable deaths and disabilities. Dr. Basu showed us a picture of one in India, but we know that for every woman that dies in some countries, 20 are disabled or have complications, and that's a major issue. Families often fall into poverty due to the costs of dealing with this care and the loss of labor to their families and communities. And finally, the economic, social, and political opportunities for women are often delayed or lost because of disabilities related to childbirth. About half the births in the world are planned. So many of these are not events that women can anticipate. What are the objectives of our action group? Well, we seek to enhance human well-being and dignity, improve women and child health and empowerment, seek sustainable balance between population and environment, and be a resource for districts and clubs in the maternal child health area of focus. The Rotary Action Group was founded in 1995 as a rag for population and development. We've changed now to focus a little bit more on the actual issues that are confronting clubs, communities, and countries. We have over 13,000 members, including Rotarians, Rotaractors, country sections, and clubs. We have cadre and fellowship members, as Dr. Basu mentioned, and we're governed by a board of directors from around the world. Our major streams of action include the following. We're improving quality birthing and family planning services. We know that birth spacing is an important predictor. If all women who wanted to delay their birth were using contraception, maternal deaths would drop automatically by about 30%. We're working with Rekha Shetty and others in South Asia on enhancing status and well-being of women, making sure that they have opportunities and can express those aspirations in the workforce, in the political arena, and other places. We're building provider capacity for quality maternal services, and again, that was provided with the COM presentation just shortly ago. And we're supporting comprehensive sex education and skills of youth in South Asia through centers that allow young women to think about alternatives to early childbearing. And we're promoting education as one of the proximate determinants of long-term development for young people. Girls who stay in school have better outcomes both in terms of maternity and in terms of their workforce participation. And finally, the new work stream is TINA, as described by Dr. Basu. I won't provide more detail on that. So we are not doing this alone. We're essentially working to support the Sustainable Development Goals as the UN and other professional bodies and Rotary is doing. We have a history of global cooperation with maternal health as well as vaccination and others. We know about the scale up of high impact health practices. We know what works and what can save lives. And we're committed to promotion of universal health coverage and reproductive justice, two critical issues from now until 2030. And finally, we want to make investments to make sure that women's lives are considered worth saving by their communities. We want to make investments in building health systems, engaging communities, supporting gender equality. It's something that was mentioned early on about girls' empowerment, promoting the scale up for public health impact, not just thinking about that clinic or those two providers, but rather thinking about how do we get to scale to actually benefit large numbers of people, and how do we ensure partnerships for sustainable development. The big issue, I think, is both follow-up of mothers and children, so it isn't a one-off, and ensure that families, communities, and health systems are invested in for those critical changes that are needed over time. So I want to thank you all. I've been brief. If you would like to know more, here's our website and my personal email, and we'd be happy to engage with each of you to improve the lives of women and children around the world. Thank you very much.
John, thank you also for sharing this important information. And, again, what you're doing is so important. I know it's not related, but as I was watching your slides and looking at the words, women's lives are worth saving, I couldn't help but think about the CNN story that I saw last week about the pregnant mother who lost her life in the bombing in Kharkiv. And I know it's not related, but it reminded me that, women's lives are worth saving, and the work you're doing is remarkable. I would ask that you would do the same thing, please. If you would put your personal email in the chat so that any of our Rotarians who are on the call may reach out to you directly with questions, we certainly would appreciate that.
Sure.
I want to thank everybody for participating today. Dawn and Clinice and Cindy and Himansu and John, thank you so much for being part of our program today. Our next Zoomformation call is going to be on May the 2nd. And in May, we celebrate youth services. So that will be our focus for the call. See you in Houston. See you on Zoom on April the 23rd and 24th for our special program of Rotary Works Encore. And see you at the reception in Houston. Bye, everybody. Stay well.